Good afternoon, everyone. Thank you for joining us virtually today. I'm joined by Tony Stack, CEO and Director of Education with the English School District, and by Dr. Janice Fitzgerald. You just heard Dr. Fitzgerald, Minister Haggie, and the Premier. I would like to thank them for their leadership during this situation and going forward. This morning, in consultation with the English School District, we made the decision to temporarily suspend classes at Elwood Elementary School in Deer Lake for 2 days, today and tomorrow, to allow time for contact tracing. This decision was made using an abundance of caution. This is the result of a positive test from a student at this school, which was confirmed just after 8 a.m. this morning. We took this step to ensure effective contact tracing is possible. In any public health investigation, if a student or staff member is considered a close contact of an individual who has tested positive for COVID-19, they will be contacted by public health officials. I've always indicated that there is no cookie-cutter approach to how we deal with COVID-19 in our schools, and I've said publicly on many occasions that any particular situation could lead to measures ranging anywhere from the absence of a student, the closure of one or multiple classrooms, the suspension of classes in a wing of a school, or even the closure of a school or multiple schools in a region. Whatever decision we ultimately make, it is based on guidance from public health and consultation with a number of professionals. What we are doing here today is suspending classes in one school to allow for proper contact tracing with the best interest of the health and safety of our students, educators, staff, and their families in mind. This is the first time that we've had a situation in a school, and we want to ensure that the return to school plan we've put in place works properly and effectively. That is part of the reason for this decision today. Once contact tracing is complete, we will provide an update on next steps as it relates to this school. I know there is significant concern in the community of Deer Lake today, and I certainly appreciate that this concern gets amplified for people when their children are involved. My message to the community right now is to please let public health do its job and to please follow guidance from trusted sources. If we act together based on medical advice, we will get through this challenge and future challenges in the safest possible way for our communities. In closing, I want to say that I've had several discussions with the Premier as we dealt with this situation, and his guidance and leadership is appreciated as we move forward. So with that, I'll pass it back to our moderator, and we can answer your questions.
Thank you, Minister Osborne. For the benefit of our speakers, we have 5 reporters registered for today's call. We will conduct the question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any further questions. Our first questions are from Peter Cowan of CBC News. Please go ahead.
Thanks. You've said all along the strategy is to have students grouped into cohorts so that there's a limited number of contacts in this situation. So can you explain why you need to close the whole school then if the idea is that this one positive case should only have interacted with their immediate class?
Thank you for your question. The answer quite simply is that yes, this class is a cohort. This is the first time we've encountered a situation where we've had a positive test within the school, and we do have a great deal of confidence in the return to school policy and plan that was developed by the English School District and the department in consultation with public health and a number of officials and professionals. Because this is the first instance, I would rather that we acted with an abundance of caution than to look back and think that we should have. Because this is the first case, we've taken this action to ensure that all the measures that we've put in place in our plan and the contact tracing can be followed through and done properly and effectively.
Is there any plan to move to online learning for those students? And can you give us a status of what the Chromebook numbers are that were to be deployed across the province to students in order to make sure that they could do online learning?
Yeah. I'll ask Mr. Stack to answer that question, but I do know that we've had discussions today about assignments being sent to the students that are off today and tomorrow. Mr. Stack?
Thank you, Minister. Appreciate your leadership on this issue. So what we've done today, or what is taking place, is a suspension of face-to-face instruction. Teachers remain at work. So today they'll be preparing for connectivity with the student population. Tomorrow there could be activities. We're asking parents to be prepared for that connection outreach, and this is a good opportunity to test some of that in this situation. It's not a complete, full entry into a Scenario 3 model because it is only a couple of days, but it is an opportunity to do some connectivity and some testing, and for those students who are not ill are able to participate to the extent possible with their teachers. With respect to the Chromebooks, Chromebooks, by the way, are only intended for grades 7 through 12. So this is an elementary school, so the Chromebook situation is not impacted here necessarily. But to answer your question, we expect first delivery of Chromebooks the week, at the end of this week.
Our next questions are from Brian Callahan of VOCM News. Please go ahead.
Thank you, and good afternoon, Minister and Mr. Stack. I'm wondering, given what's happened in Deer Lake, and I know you talk about the abundance of caution and being proactive, has any consideration been given to schools in Grand Bank before a case occurs there?
That question for me?
Well, either the Minister and Mr. Stack.
Not at this time. We're full confidence. We have a great interaction with public health. All of our regional headquarters are interfacing with the regional health authorities, and we've had timely information, and at this point there is no impact on schools in Grand Bank.
And with regard to the NLTA, of course, Mr. Ingram has made several statements regarding the latest cases, and he is certainly looking for further tightening of health precautions, specifically mandatory face masks in schools and physical barriers between students and staff or teachers. Where are we with those considerations?
Well, from a school perspective, we are following the advice of public health. So the public health directives with respect to mask wearing in schools are being adhered to.
There's been many, just on that note, sorry, not a third question, but there's many anecdotal and parents and that sort of thing saying that it's just not happening. I mean, it's impossible to keep the distance, and there's a lot of complacency with regard to face masks. Are you aware of this? Or are you content?
No, well, certainly we can reinforce those messages. I think any time that we have COVID cases in the province, it certainly highlights the concern, and we can emphasize, re-emphasize with our students the importance of mask wearing, and put those key messages out to our staffs to relay.
I think as well, just to expand on that, whether it's within our schools or within the general public, sometimes, because we've done so well, and really the envy of many other jurisdictions globally, some people may get complacent. I think the fact that we're seeing a rising number, the fact that it's the first case in a school, it is a good time to confirm the need to follow public health guidelines and to ensure that we remain vigilant. We've done very well in this province, and we're going to continue to do very well in this province. At the advice of our Chief Medical Officer of Health and Public Health have to be followed.
Thank you.
Our next questions are from David Marr of The Telegram. Please go ahead.
Thank you very much. I'm wondering if the 2-day pause now that we're seeing in Elwood to allow contact tracing to take place, is that more or less the model that we can expect to see? Should there be any future cases reported in other schools around the province?
I can answer that and probably followed up by Mr. Stack. I've indicated several times that every situation is different based on where we are in terms of community spread, the number of cases in a province, the community that it's in, whether the community is more isolated or not. But in this particular case, this decision really was made by government in consultation with the English School District because we wanted to take an abundance of caution, simply because it is the first time we've seen a case in our schools, and we want to assure that the protocols and the plan that we've put in place and the contact tracing, that everything will run as it should. We want to ensure, again, the abundance of caution. I think I'd rather be overly cautious than to look back and say, we believed everything was in place, we missed something. So we are using this opportunity, which is the first time that we've seen a case in a school, to ensure that everything that's in place works as well as we anticipate it should. Mr. Stack?
Thank you, Minister. So we have been interfacing with Dr. Dutt. Dan O'Brien, our regional director in Western Region, has been interfacing with Dr. Dutt extensively over these last few days. We have full confidence in the Regional Health Authority in Western, who have enacted rapid contact tracing notifications to families. There's no question that they've done so diligently, and notifications were out early this morning. And if any student or staff member is considered a close contact of an individual who's tested positive for COVID-19, they will be contacted by public health officials, and we have every confidence that that has taken place. If your child is not considered a close contact, then you would have been contacted. But out of an abundance of caution, again, this is the first time through for us. I don't think it templates how we react in the future. And as I've said, it also gives us a bit of an opportunity to run through some protocols around connectivity for students and reaching out, and we will use the lessons learned here and extrapolate them should we have to do this in another area, but it may not look exactly the same. For example, a suspension of classes for an entire school may not be required.
Thank you very much. Question for Dr. Fitzgerald. I know in the city of New York there was like a 3% positivity rate identified that kind of triggered the overall shutdown of their public health system. Public school system. I'm wondering if there's any kind of similar metric that public health is keeping their eyes on that could trigger a more widespread shutdown.
So there's no one metric that we're relying on. Did you say a 3% positivity rate?
I believe that was the metric in New York City, yeah.
That's quite low. So certainly, our positivity rate is even lower than that. But it's, that's one thing that we look at when we're looking at the spread of COVID-19 in the province. And we will also be looking at non-epi-linked cases. We'll also be looking at the rapidity of rise in cases, the number of contacts that people have in cases, that cases have. Those are all things, if we start to see that the number of contacts is going higher and higher and it's becoming more difficult to contact trace efficiently, all of those things will impact the decision as to whether or not we make any kind of restrictions, whether it be with schools or with anything else. So we can, at this point, we're not there, but those are things that we will always consider.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I guess this question is for Mr. Stack. The NLESB put out a notice from Dan O'Brien on Twitter yesterday regarding the case in Western Hills, saying that they advised the school district that there is no reason to adjust our school operations in any way at this time. This is just last night notifying for today's classes. So what changed in this less than 24-hour period?
Well, what changed was a positive case. So health have been, as I say, very proactive and very timely in their communications with our counterparts in the regions. And very early this morning, that changed. So that caused a set of decisions to be made very rapidly.
Thank you. And a testing site has been set up at the town hall in Deer Lake, a drive-through site more than anything. Do you still need an appointment to have these tests done out there if your child was a student at school?
I'm sorry, Kellyanne, I missed your question.
The testing site in Deer Lake at the town hall, there's a lot of cars coming through it. I'm just looking to clarify. You still need an appointment to get a test done, even if you were a student at Elwood Elementary?
Yes, you do need to have an appointment, but anyone who was considered a close contact in the school has been notified by public health staff about an appointment time for a test. So that those close contacts would have that information.
Thank you.
Our next questions are from Sarah Smelly of the Canadian Press. Please go ahead. We'll move on to Peter Cowan of CBC. Please go ahead.
Dr. Fitzgerald, I'm wondering if you could walk me through what the contact tracing process looks like for a school. So we clearly know that the same cohort of whoever tests positive, presumably including the teacher, are all going to have to isolate and get tested. Give me an idea of some of who else the close contacts could be. So, for example, did this person ride the bus? Things like that.
Yes, so those are all things we have to consider. So first thing we look at, of course, household contacts. We know that this person traced back to a cluster, so, this person was already isolating. So those contacts were low outside of school. The first thing they would look at it within the class, they would find out who was in the class. They'd get class lists. They would notify those parents of the children who were in the class. And then they would ask questions of the parents, and if they have permission from the parents to discuss the case with a teacher who may have some information about where the child may have moved in school, then they will do that. So then they may find out, if there's been any other teachers that they may have come into contact with, for example, gym teachers or music teachers, that sort of thing. They would ask about extracurricular activities and anyone they would have come into contact in that regard, anyone they may have played with that isn't in their class, those sorts of things. So those are all the questions. And then anyone who has been identified as being a close contact, so they would have fairly consistent exposure to the person, such as in a class or where you have been inside in close proximity for more than 15 minutes, not wearing a mask, that sort of thing. Those would all be considered close contacts, and they would be advised to quarantine and to get tested. So
there are parents who don't get notified that their child was a close contact, but they're still worried because they were in the same school. They're worried their kid may have, passed that other kid in the hall, things like that. Can they still get a test if they want?
So we have to remember that, this virus it does take a fair bit of exposure to pick it up. And that may be, we do have people who attend gatherings together. They're in the same space that may be poorly ventilated for a period of time. They may not be wearing masks. So in those situations, it's a little more easy for it to spread. If you're passing in the hallways, especially if the hallways are not crowded, which, I would think they tend not to be for most of the time in elementary school. But those are very low risk. They're very short periods of interaction, so they're not considered to put somebody at risk for COVID-19 exposure. What we will say is that anyone, who's been in school, and certainly anyone in the province really who develops to monitor for symptoms, if they develop symptoms that are consistent with COVID-19, then they certainly need to be tested. But for someone who doesn't have any symptoms, who doesn't have a close exposure, then testing is not really warranted.
Thanks.
Our next questions are from Brian Callahan of VOCM News. Please go ahead.
I know that you mentioned that the positive test was confirmed just after 8 o'clock this morning, so I imagine a lot of students were probably already at school, dropped off, en route. How did the logistics of that play out this morning? Was it just a notice at the school and everybody was told to turn around and go home, or how did that work this morning?
My understanding is that calls were made very early, very rapidly this morning. We took at the prompting of health, provided class lists in advance of today, just in case, again, being very, very cautious. And those were followed up on immediately this morning. The attendance rate was as well also low in the area. So my understanding is, now I don't have detailed information, and maybe health have more, that the contacts were all made in a timely fashion. And there was one fortuitous bus delay that we're aware of that also helped in that situation.
Just not as a follow-up, but just for clarification, attendance was low. Do you know why that was, and what were the numbers or drop-off, and what was the reason for that, do you think?
Well, I would imagine it was apprehension within the community, understandably so. So the attendance rates were very low, less than 25%.
And as a second question, as follow-up, can I ask if consideration has been given to requiring staff, teachers, anyone who works in a school, whether or not it should be mandatory for them to have the app?
For them to have...
As another tool in the toolbox,
The COVID app.
The COVID app. Oh, I see. I think, like anything else, the government of Canada, certainly the government of this province, have encouraged the use of the app, and we can help promote that for sure. But I don't know if there's any kind of mandatory way to check for that. A lot of personal phones in use and such, and really it comes down to a decision on the individual as to whether or not they're going to download that app.
I guess I'm just thinking of the seriousness here, and it's been repeated over and over by the government and everyone else who is aware of how this app works, that there are no privacy concerns. We've been assured of that. So I'm thinking about another tool in the toolbox and whether or not this might be necessary, given you're talking about closing schools,
Well, from a district perspective, we can certainly promote the use of the app, for sure.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi, just one question for me. You're talking a lot about lessons that you'll learn from this situation. Any early lessons you can share about how this has been managed so far?
From district perspective, I think any time that we go through this process, we are the dialogue that occurs between our regional staff and the regional health authorities is good. We solidify those contacts. We go through possibilities, but no, I can't land on any one particular lesson learned out of this, other than it cements the relationship and informs any future possible scenarios that we have to deal with.
Thank you.
Our next questions are from David Marr of The Telegram. Please go ahead.
Thank you once again. I'm wondering if you could speak directly to the parents of the province out there. What should they do should their child test positive for the virus? What kind of isolation measures should they set up at home? Those kinds of things.
Sorry, David, you were kind of faint. Are you asking what should parents do if their children become symptomatic? Is that the question?
If they, yes, and if they receive a positive result.
Oh, okay. So everyone who was identified as a close contact has been asked to isolate. So they would already be isolating right now. So for any of those parents, we want them to monitor the health of their children. If their children start to develop any symptoms, then obviously they need to avail of the 811 system, whether that's online or through a phone call, to determine if the child needs testing. And if the child does, then obviously we would encourage very strongly for parents to take their children to get tested, even if they have a negative test today. So because we know that a negative test on one day does not mean a negative test on another day. So even if people have a negative test today and they develop symptoms at a later date, they should still go and get tested again. Anyone who tests positive today with this round of testing, the same process will happen. We will start with contact tracing. We will identify all of their contacts and test all of their contacts. And, we'll make decisions then based on any further information that we get. But public health will be in touch with any of those, with the parents of any of those children who do test positive. And certainly, I think public health will be in contact fairly regularly over the next 14 days.
Thank you. That's it for me.
Kellyanne Roberts, please go ahead.
I'm wondering about the sanitization within the school now, where you're closed for 2 days, but teachers are in there today. So is the sanitization process for this particular classroom completed?
So at the end of every day, we go through our full deep clean routine in all of our schools. And in the case of Elwood Elementary, that would have been the case. So they would have shown up, all of the staff and students that were present this morning before dismissal would have encountered a clean school. And at the end of this day, and just like every other day, we'll go through that procedure again. All desks, high-touch surface areas will be cleaned as per our protocol that we have outlined with our return-to-school plan as coordinated with public health advice.
Thank you. And I just one other one regarding the timeline with the 2 days close. Obviously, I know we're kind of making it work as we go through it. But is 2 days a realistic enough time? Do you not think maybe a week? And if after these 2 days, is it just that class that's still isolating and the rest of the school is back?
Yeah, I think, Kelly, we wanted to ensure that the protocols we had put in place, the connectivity between public health and English School District officials and the department, we wanted to ensure that everything was in place and operating as it should. We have confidence in the plan, but again, an abundance of caution here, I think is, as my grandmother used to say, an ounce of prevention is worth a pound of cure. Having said that, I think a week here would probably have raised anxiety levels within the community. And, while while the public health and the chief medical officer of health and myself and the English School District will all say we have to become even more vigilant because we're seeing a second wave in other locations. We can prevent or at least significantly reduce that by being more vigilant. We have to do it in a way with our children that we don't create anxiety, because that in and of itself can cause harm to them. So, I think we reached the right balance with 2 days. I think a week probably would have sent the wrong messages.
Thank you.
Peter Cowan, do you have any final questions?
A couple of quick follow-up questions. Does this change anything around the policy around allowing extracurricular activities and outside organizations to use the school?
So, yeah, Peter, thank you for that question. We are, as we said when we released the information with respect to extracurricular activities, that we would assess on a regional basis. So as we speak, the folks back at my office are going through this right now, and we will consult, of course, public health as we always do. And if we have to curtail extracurricular activities in a particular area, and Deer Lake would be one that we'd be looking at, then we will certainly do that.
And a question for Dr. Fitzgerald. You mentioned in the break that active cases is actually one of the least useful measures to be able to compare provinces. Can you give me an idea, what are some of the numbers that are good as we're trying to compare the situation between the different Atlantic provinces?
So, yeah, so, I mean, on that, I don't want to give the impression that that active cases is not something that, you know, for the public that's a useful thing for them to know. It's just from our point of view, from our response, active cases are not really what we would be looking at from a public health point of view. You know, we would be looking at, as I said before many times, these non-epi-linked cases. Those are the big ones that we worry about. We look at our, you know, our average number of cases a day, and we look at a 7-day average on that. We also look at our percent positivity in testing, we can look at the RT at times. But none of these in and of themselves we wouldn't rely on any of them exclusively. All of them have their benefits, all of them have their drawbacks. And so that's why we have to look at, all of them together and look at the picture together in order to determine what our actions will be. And, you know, then we have to consider things like healthcare capacity and public health capacity, which at this point is, you know, in the prevalence that we find ourselves now, it's not really something that's that we're worried about. But if we were to see more cases, then those would be two very important indicators for us with regard to, you know, tightening restrictions, that sort of thing.
When it comes to contact tracing, you mentioned, for example, you know, there's now an additional 20 to 25 people in Deer Lake who are having to isolate, you're having to do contact tracing. As these new cases come online, how much capacity do we have that if we started to see a rise in cases that we'd still be able to identify and get those folks tested within 48 hours like we have been?
Right. So none of the people that are in isolation right now that are in this cohort need contact tracing except for that one positive case. We don't do contact tracing until we know we have a positive case. And so I just wanted to clarify that. But if, you know, we do have over 170 people who are able to do contact tracing in the province. And we have seen in Eastern Health, for example, when we had the large outbreak that we had at the beginning of the pandemic, that we certainly had capacity to be able to do that contact tracing that was necessary then. So, and we've had a lot of lessons learned. We know that, you know, if we need to provide help from one area to another, we can certainly do that. We've also taken the step to engage with the federal government to have people who are trained in contact tracing as a backup if we need it. And we've also looked at training some of our some people here in the province as well in contact tracing and contact follow-up. So, you know, we are looking at increasing that capacity, just seeing what's happening elsewhere across the country. But at the moment, our capacity is good for public health and contact tracing.
Okay, thanks.
Brian Callahan, do you have any final questions?
Yes, thank you. I didn't catch the entirety of the previous briefing with the Premier, but I'm curious as to, I just wanted to know the percentage of PPE. What's the province's complement right now? I thought I saw a note that said it was at 80% last week, but I'm not sure, and I'm wondering if we're up to 100, or if not, why not?
So I believe the minister made that statement in our briefing last week. I would have to defer back to the department to be able to answer that question, Brian.
Okay, and thank you, Dr. Fitzgerald. I wanted to apologize off the top. I think I acknowledged the minister and Mr. Stack, but I inadvertently didn't say thank you to you as well. And my last question, I've heard from some substitute teachers who are asking, they say they were asked to complete training prior to working when there was a critical shortage. They did that start of the school year, and to date they say a lot of them have not been paid for the training, 3 months worth, I understand. And they're also worried that if we do go into a shutdown, that they're going to be left on the outside looking in, and they're worried about the so-called quote-unquote financial safety net, how the province will take care of them if that happens.
So on the payment for the training, first time that's been brought to my attention, we will engage at our level. We have a payroll division, but we also interact with teacher payroll in the province here in the building. So we'll look after that. We'll have and then see where that is.
Yeah, I guess
sorry.
in terms of what happens. I mean, it's a hypothetical situation. I know when we experienced the first wave of COVID, government had worked very hard to ensure that early childhood educators, for example, lower income essential workers and others, that we were able to assist them. So if we get into a second wave, that's something that would have to be discussed with a number of ministers and the federal government as well to determine a way forward there.
Thank you.
David Marr, do you have any final questions?
Yes, forgive me if this is best kind of deferred back to the department, but Dr. Fitzgerald, I'm wondering if there's been any changes or increases to hospital capacity, to ICU capacity, in the, God forbid the second wave doesn't reach the shores, but have we had any increased capacity on that front?
Increased capacity in, I'm sorry, David, you were breaking up a bit. I had trouble hearing you.
Forgive me. I'm wondering if there's been any increase in capacity at hospitals and ICU, in the event the second wave doesn't reach here.
Okay. So once again, I'll have to defer you back to the department. Perhaps you can send an email. I don't have that information. It's not really part of public health's domain. So.
Okay. Thank you very much.
And Kellyanne Roberts, do you have any final questions?
I do. I have one regarding cohorts using the same bathroom, where it's not possible to clean the bathroom every time our children from a different cohort uses it. So how does it work for contact tracing then in this situation?
So we would consider that to be very brief contact. Generally speaking, it's usually less than 15 minutes, and I guess if it's more than 15 minutes, hopefully you're in a stall. So it's not going to be a big issue from a contact tracing point of view. So, we don't generally go down that road when we're looking at contact tracing.
Thank you. And I have one other question in regards to students, but maybe not so much in this situation. But in regards to traveling home for Christmas, your advice for those who may live or may go to school in Ontario or elsewhere in Canada, but looking to return home for Christmas.
My advice for those people?
Yes, as they would be residents of the province.
I mean, certainly if they're coming home from Ontario and those places, then the expectation is that they will self-isolate as the orders have asked or dictated. And, it's really important to try to keep yourself as separated as you can from your family. And if that's not possible, then your family will have to isolate with you as well. If it's possible not to travel, then obviously that's the best option, and to avoid crowds and gatherings and all of those sorts of things that we've been saying all along.
Thank you.
Thank you, Kellyanne. Minister Osborne, did you have any closing remarks?
Just to thank Mr. Stack and Dr. Fitzgerald for being here today. Thank the media for joining in and getting the message out to the general public. And again, I know Dr. Fitzgerald and Minister Haggie, the Premier, have said it earlier in the briefing, and every time they get the opportunity, but just urging everybody to be more vigilant, to start exercising more vigilance when it comes to following the guidelines of public health. You know, as Dr. Fitzgerald said, we can significantly reduce the numbers of cases in this province that we've seen in other provinces if we do so.
Thank you very much, Minister. Thanks for tuning in, everyone, and have a great evening. Bye-bye.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.